Singapore has started vaccinating people aged 70 and older against COVID-19. About 250,000 Singapore residents have received their first dose. The government hopes to have the entire population inoculated by the end of 2021. And Miro Liu is reporting live for us now in Singapore. Hello there, Miro. Tell us more about this vaccination scheme and who has priority.
Yes, hi, Momo. Now, the focus of Singapore's vaccination program has been to protect the most vulnerable first. As you mentioned earlier, around 250,000 people have already received their first dose of vaccines, and of these, over 100,000 have got the second dose. These mainly include frontline workers, hospital staff, marine and shipyard employees, aviation staff, as well as government officials. Starting today, those aged 70 and above will be able to get COVID-19 injection at 11 vaccination centers across the city-state. The nationwide drive comes after a successful pilot program for the elderly where more than 5,000 seniors received their first dose of vaccine. At the moment, Singapore has approved Pfizer-BioNTech as well as Moderna. Next in line will be the people in the age group of 60 to 69 years old who should be received their invitation letter by mid-March and their jabs towards the end of March. In fact, earlier today, I visited one of the vaccination centers in one of the community centers in Singapore. There was a steady flow of people coming in to get their jab throughout the day. While some were brought down by their family members, a significant number of elderly was shuttled to the location by their community centers. Vaccinations are being conducted only through appointment basis because of the safe distancing measures that's in place in Singapore. Or eligible people will receive a letter from the Ministry of Health instructing them how and where to book their appointment, which can be done online and offline. On location, people are required to fill in a form detailing their medical history. Once confirmed it is safe for them to receive the vaccine, they are then taken to another area for the injection. After the injection, they're also required to sit in a monitoring area for at least 30 minutes to ensure that there's no adverse reaction to the vaccine. So the vaccine program is well in the way, Momong.
Well, Miro, let's also talk about another vulnerable group. 90% of Singapore's COVID infections have been in the crowded dormitories of migrant workers. What's the vaccination plan for them? Yes, it's true that the migrant workers have been the worst affected community in Singapore. We have covered that on this program last year. In fact, as data released in December last year, more than 150,000 workers, or close to half of the migrant workers living in those cramped dormitories, had been infected with coronavirus. In order to bring their cases under control, the Singapore government engaged in extensive testing and very strict movement control measures. In fact, even till today, these group of people are only allowed to leave their dormitories for work or to specific recreation centers for a certain period of time. With regards to their vaccination plan, speaking in the country's parliament earlier this month, Singapore's second minister for manpower revealed that all migrant workers will be vaccinated by the end of this year, along with other residents. He also added that the priority will depend on the risk assessment of the dormitories. As of now, these people are working, but they are being tested every 14 days to ensure their safety.